This is Alicia Alt reporting for Global Medical News Network, and I'm here today with Mr. Jonathan Blum. He's the director of the Center for Medicare, and we wanted to talk to him about accountable care organizations, or ACOs. So one of the first things I wanted to ask you, this regulation invites groups of doctors or hospitals or healthcare providers to apply to be an ACO. And this has been widely anticipated, but there seems to be a question out there of how many of these organizations or individuals are actually going to apply. I think the rule estimated maybe 75 to 100 initially. Can you give us a sense of where this might go, at least in the first year?
I think one thing to keep in mind is that the rule envisions many kinds of organizations coming into the program. So hospitals working with physicians, physicians working in group practices, physicians coming together for the first time. So our goal is not necessarily to set a target, but to have the goal that we want lots of organizations coming into the program, different types, different configurations.
So in going around and talking to physicians, have you gotten a sense, is there excitement, is there pent-up demand, is there skepticism, are you getting a little of everything?
Well, I think we're getting tremendous interest and excitement, and I think no other rule that I've been associated with than the ACO rule has generated so much interest and comment. We've been doing open door forums the last couple of weeks and have had thousands of people on the phone, which is a great sign that there's tremendous interest. To be fair, there are questions, and we expect lots of comments to come in for the proposed rule, and CMS will go through every comment and study them carefully. And
what about the timeline? Now, the hope, I guess, is to take applications, have them processed so that the first ACOs are up and running in January, but the agency did propose some wiggle room. How likely is it that that Plan B would go into effect where you would have to have a later start?
Well, right now we are very much committed to putting the program, starting the program by January 1st, 2012. But this is a very complicated rule. We have 5 different federal agencies who have also been working together to coordinate. So this is not just CMS, but we have the antitrust agencies who are contributing. We have the Inspector General's office. We have the IGs. We have the IRS with tax guidance. So this is a very complicated rule. Our commitment is to get it right. Our commitment is to get a rule finalized that responds to all of the comments, but we are also very much committed to having the rule start January 1st, 2012.
I think another question that physicians might have, aside from all the antitrust considerations, is what's going to happen with their patients. So what does CMS envision as far as educating beneficiaries about how the program works and whether they can opt out?
Well, I think a couple of things. I mean, one, that the ACO program is part of the traditional fee-for-service program. So while we want beneficiaries to be in more accountable healthcare delivery organizations, we also need to be communicating to our beneficiary community that this is part of the traditional fee-for-service program. They still have freedom of choice of physician, of hospital. A
lot of physicians, hospitals, provider organizations are anticipating making an even larger investment in health IT than they have been, and a lot of them have been on that road, but that is a big area of concern for physicians. Can you give them any sense of how much more they might have to invest or what they might be looking at?
Well, one of the things that we thought very hard about with the ACO proposed rule is that we wanted it to be closely aligned and coordinated with our high-tech program. And so we have tried very hard to align and to coordinate our quality measures with the similar kinds of measures that are required for the high-tech incentive programs. So that does a couple things. One, that it reduces burden on physicians and hospitals who are all submitting data through the various programs, but at the same time that it creates revenue sources. So we have a proposed measure that an ACO should should seek to ensure that 50% of their physicians are meaningful users under high tech. Does two things. One's to advance the goals that the ACO program has of better coordinated care, but at the same time creates new revenue sources that can help offset some of those costs.
And finally, can you give us a sense of when you think CMS, if everything goes as planned, would have the final rule?
Well, we have given providers and stakeholders 60 days. We expect a lot of comments. I mean, there is tremendous interest, so that's exciting. But at the same time, we expect lots of comment. We expect lots of feedback. We're going to have to pore over very carefully every comment that we receive because we're sure they're going to be well thought through. So we are committed to having the final rule out this year. But given the heavy interest, given the volume, given the excitement, this is going to be a comment period that takes a lot of time by us to really carefully review, consider everything we receive. So I'm anticipating lots and lots of comments. That's exciting, but it also causes more work, which is good. But we will have the final rule out this year.
All right. Thank you very much for your time, Mr. Bloom.
Thank you very much. Thank you.
This is Alicia Alt reporting for Global Medical News Network.